In today's video, we will be covering some of the common reactions and what to expect during your ketamine therapy. In this video, we've compiled the most frequently asked questions and concerns to give you a comprehensive guide. Stay tuned to get all the answers and tips that you may need for a smooth post-ketamine treatment experience. And today we're going to cover some things to expect after your ketamine treatments. So, number one, you might feel some fatigue or tiredness after your ketamine infusions. This is within normal limits. A ketamine infusion is like a journey for you and your body and your mind. So, expect to feel a little bit of fatigue as a possibility post-infusion. As an example, after you get back from a vacation or a camping trip or some journey, you might find yourself being a little bit tired once you come back home. And that, again, is similar to the ketamine experience, where it is still within normal limits. There are several factors that affect this, including the ketamine dose and how you may feel before the infusion. Remember, the higher the dose, the more tired you may feel, and you might experience some other side effects, nausea, headaches. So if you feel a little bit extra tired or nervous before the infusion, that might actually show up post-infusion as well. And so, this is why we encourage our patients to have a good days of rest before the infusion so that you can feel more relaxed and at ease, and it can potentially lead to a more pleasant experience. Number two, you may feel nausea or dizziness as well. So depending upon how you respond to the ketamine plus how much you're receiving may affect the chances of you feeling nauseous or dizzy. Specifically like a room spinning type of sensation, kind of like you got off a merry-go-round. If you had that higher dose, you might feel a slightly floating feeling, and it might last several hours after the infusion. Also remember that if you do have any side effects such as nausea or dizziness, and it persists, please speak with your ketamine specialist regarding this so that they can give you medications to help prevent it and reduce those symptoms. Expectation number three. You might feel a little bit more vulnerable. Ketamine infusions can make you vulnerable because at times, maybe you might have had a near-death experience, or you might have had an experience pulling up these old, deep, repressed emotions that have been buried underneath of the surface. And you might have even encountered some painful truths. These challenges can leave you feeling emotionally raw. If you feel this way, it's really important that you have someone to talk with after the infusion. It might be your integration coach. It might be your psychotherapist or psychologist, or it might be a really trusted friend who is in your corner. Alternatively, it may be something as simple as journaling right after your ketamine treatment, which will allow you to kind of unpack all of the various emotions and experiences to help process things a little bit better. Number four, there might be feelings of confusion or uncertainty. You might have experienced something that you didn't expect. Similar to the sense of vulnerability, you might feel open and unsure about what you saw. You may be wondering about what those psychedelic geometric shapes that you saw may have mean. Or perhaps you even had an experience of talking to a loved one who has passed away. You're probably going to have a lot of questions afterwards, which might leave you feeling confused, uncertain, but don't worry, please, that is okay. We truly believe that whatever experience comes up shows up for a reason, and there's a purpose behind of it. So it might take not just one day, it might take several days to unpack. Really, the key is to understand that all of these emotions that come up, being able to unpack those with someone that you trust. Again, that integration coach, the therapist, a close, trusted friend. Really important to not keep these emotions bottled up, because frankly, they may have been bottled up for years. Number five, you might be feeling inspired and peaceful and calm. So we don't want you to think that post-infusion, that you're only going to be experiencing these negative emotions. In fact, you might also feel a sense of lightness, calmness, enlightenment, peacefulness, pain-free feelings that you've never felt before. It'll be strange, possibly. So enjoy these positive feelings that may come up and be grateful for it. We even recommend that you instill these good habits into your lifestyle so that you can make the most out of these powerful emotions that we can have. Experience number six. You might be feeling introspective. So specifically, sometimes during the infusions, you might get a lot of these downloads or lessons or insights or epiphanies. You might have that near-death experience or out-of-body experience or feeling of universal connectedness with everyone on the planet. And that can accordingly make you feel introspective and realize things, and you may see things in a completely new perspective. Again, it may depend upon the dosage as well as the set and the setting. And what we've noticed is that the higher the dose, the higher the chances of these type of experiences coming in as well. Not necessarily for everyone, but again, there may be a small correlation there. Finally, remember that each experience is different. Please don't judge it. Please go with it and allow it to be there. Because, there's that old saying, you don't always get what you want, but you always get what you need. So despite me listing all of these possible experiences above, each person's experience based upon your own unique DNA, different from all 8 billion people on the planet, and your own life experiences, it's going to create a different type of experience post-infusion. So I can't tell you exactly for sure what's going to happen and what you're going to feel like after the treatment. So be open to that unknown, the possibility of what you experience, and just trust that it is exactly what you needed for yourself. And maybe even remind yourself, yes, there were some downloads, there were some insights to be had post-infusion, whether it was very challenging or whether it was really positive. One of the questions that we get asked about is feeling tired or fatigued after a ketamine session. So for a moment, I want you to think about if you went on a long journey. Let's say you went on a camping trip or a vacation, and then you got back from that journey. Well, guess what? You would probably be tired. Now, similarly, when someone has a ketamine journey, you can go explore some unusual places and dimensions and swim around in the unconscious mind. So it's pretty normal for someone to feel fatigued after the infusion, maybe even 24, 48 hours after the session. We actually have a term for that. It's called the quote, ketamine hangover. So don't be alarmed if you do feel a bit tired or more sluggish than usual. Usually it will fade away on its own. Just give yourself some patience, give yourself some time. Think about this idea that, hey, I just went on a journey, I went on a trip. And of course, to be expected that you may have some fatigue afterwards. Now, looking at the evidence behind this, there are some interesting studies that came up that showed that sometimes ketamine can actually have an anti-fatigue effect, where some people may feel even more energized. And we have seen that in some select group of our patients, where after the ketamine infusion, they actually feel more rejuvenated. And I recall one patient who, after the ketamine journey, would go for a hike, would go for a bike ride, would want to do something physically active. So not everyone is going to feel fatigued, and some people may actually feel a bit more energy after the session. So either way, whichever group you're in, whether you feel a little bit more tired than usual, or you may even feel an energy boost, it's all good. Everyone is going to have a variable response. Take care, and I will see you in the next. Today, I'm going to share with you why you might be nauseous. Plus, if you stay till the very end, I'm going to share some options that you can discuss with your ketamine specialist. So why are you feeling nauseous? There's a few things to consider. Number one, ketamine can sometimes stimulate the vestibular system. That's part of our brain that's kind of like the gyroscope that allows us to have some balance. One of the things that we've noticed is patients may report feeling dizzy. And this is because mainly the vestibular system is affected by ketamine therapy. So, one of the things that we'll see on a patient is something called nystagmus. And that's where the eyes are literally kind of shifting back and forth. And that can be seen during the dissociated and subdissociative states. The second thing is we know that ketamine works on multiple receptors, predominantly one called the NMDA and methyl D-aspartate receptor. However, ketamine also impacts the dopamine receptors as well as the serotonin receptor. When those receptors are stimulated, they can frequently cause nausea. Accordingly, we have various medications that can help prevent that. And I'm going to get to that in the end. The other thing to consider is the gut brain connection. I don't know if you knew this, but the enteric nervous system, which is the nervous system of the brain, as well as the central nervous system, come from the same embryonic fetal origin. Literally, they come from the neural crest cells when we are developing in utero. What that means is a lot of the receptors that are in the brain also are inside of our intestinal system. So we'll typically see some patients who take various antidepressants and other psychiatric medications. Well, we'll notice that it also affects their gut. As one example, think about irritable bowel syndrome, IBS. Sometimes that is frequently occurring with such states such as anxiety and depression. The last component to consider is maybe even a spiritual or energetic connection with nausea. One of the things I've noticed is sometimes when a patient is thinking about something, maybe a remote history of trauma or some other adverse effect experience in their life, they may feel nauseous. They'll say, I feel sick to my stomach thinking about that individual or thinking about that incident. Well, it's because there is this connection between the psyche and gut. Now, let's consider some options that I personally suggest for our patients. Number one is fasting prior to the ketamine infusion. This is really good because it'll be an empty stomach, meaning less likely to develop nausea. Also, ketamine can be potentially relaxing the esophageal sphincter, which will allow food contents to come from the stomach and into the throat, causing aspiration. So it's really crucial to fast prior to the ketamine infusion. We also have various medications. One of the classic ones is called Zofran, also known as ondansetron. If you think about the mechanism of action of this medication, it's actually affecting the serotonin receptor. It's a serotonin receptor antagonist. So, since we know that ketamine can potentially stimulate the serotonin receptor, we can use medications to block that activity. Another medication we use is called Reglan, and Reglan can actually stimulate and block the dopamine from activating the dopamine receptors. So, again, as mentioned earlier, ketamine can stimulate dopamine receptors, so we can block activity of that using the medicine called Reglan. Finally, there's another medicine called meclizine, also known as antivert, and that's kind of a gentle anticholinergic, which will help reduce stimulation of that vestibular system that I had mentioned earlier. It's classically a medication used for like motion sickness. I think it's called Bonine, over the counter available. So that is another medicine, meclizine, that can be used. I hope you found this information
If you're
useful, and I will see
wondering,
you in the next
why
Why
do
do
I
I feel terrible after ketamine treatment? Then you're watching the right video. Today, I'm going to share with you why you may not feel that great after treatment. Plus, if you stay till the very end, I'll share what I recommend for my patients to address this. So, why are you feeling terrible after the ketamine treatment? Well, we actually have a word for this. It's called the ketamine hangover. And some of the typical signs of this is feeling fatigued, lethargic, headache, nausea, malaise, and just a general sense of tiredness. And this can last up to 24, 48, even 72 hours sometimes. So, one of the things you can do is mentally prepare for this, like expect and know that this could happen. And how you can even take advantage of this is plan on taking it easy for the next day after the ketamine therapy, maybe even 2 days. So don't plan any important meetings or phone calls or work if you can, so that you can really just rest and recover. You also want to just plan on chilling out and just taking it easy for the rest of the day. So, may not be the best time to go to a party or go out to a restaurant or watch a movie or meet up with friends. Rather, you may just want to chill out, sit, relax quietly and comfortably in your home or wherever you're staying. If possible, we do recommend that you have someone who can support you, someone who is in your side and in your corner. Maybe a significant other, maybe a family member, maybe someone that you just really trust. Now, please remember, if you're not feeling that great, you really need to speak with your ketamine specialist. Since this is not that uncommon, your ketamine specialist may give you specific guidelines tailored to you and your background on what to watch out for and what to do. So feel free to reach out to them if you have any concerns or any prolonged issues. And one of the questions that I got asked recently was whether it matters if you remember every single thing from your infusion. So sometimes in the dissociative state, it can be pretty challenging to recall everything that comes up just because of the simple nature of that dissociation between mind and body. So, what we encourage our patients is to trust your unconscious mind. Trust that everything you need to know will come up and will be stored in your body. You may or may not know this already, but your unconscious mind stores every single thing and experience that has happened to you and in your life. Sometimes with the ketamine experience, although you might not be fully conscious of what you're remembering, just trust and know that the information is stored within you and your unconscious mind. Now, what you can do is after the ketamine session, of course, is journal. Write down what you notice, write down what you recall, discuss it with a therapist or an integration specialist. That way you can kind of cement that information. But you don't necessarily need to be taking notes diligently throughout the entire infusion. Just fully experience the experience, let it come up, let it flow, let go, and accept the process. Let me know. The article published last year in the American Journal of Psychiatry. And the title of the article is A Novel, Brief, Fully Automated Intervention to Extend the Antidepressant Effect of a Single Ketamine Infusion, a Randomized Clinical Trial. In this article, what they did was they had participants, after they got the ketamine therapy, play a game. And this game was a type of association game where they were looking at smiling faces. So it was really interesting because the patients who played this game, they actually had a more robust effect rather than the participants who didn't. And recently I came across a website, and the website is called ketamine.games. I have no financial connection with them. I have no affiliation. One of my patients just told me about it. And this website has the same type of smiling faces, and you can customize it and you can do your own thing. And they have all of these cool little games that you can play. So one of the things that someone can do is after their ketamine infusion therapy is maybe play this game. Because as mentioned earlier in other videos, ketamine has that rapid neuroplasticity benefit. New neurons, new synaptic connections. And so we want to take advantage of that neuroplasticity. And one of those ways might be playing a ketamine game. Imagine this for a moment. You've planted a baby seed in the ground. It's very small, and as a matter of fact, it's not even sprouted yet. But over the next few days, it gradually grows bigger and bigger and bigger. But yet it's still a small plant. What are you going to do with this little tiny seedling? Is to protect it. You put a protective net over it so that different insects and animals won't eat it. Now, why is this important and how is it related to ketamine infusions? Well, sometimes you'll get these insights or ideas or revelation, and it's still a baby seed. It's still a plant that has not been fully developed and grown yet. Accordingly, if you go out and share it with everyone and tell everyone about your new beliefs, your new insight, they might look at you with some raised eyebrows, or they might even demean you and your new beliefs. So when you learn something new, treat it as if it was precious gold. Keep it close to you. Keep it in your heart. Don't tell or share with a lot of people, because some people, they may be on your side, but they may not be in your corner. So at the beginning, when you gain these new insights, keep it close to you. Share it with people that you trust. Maybe your best friend, maybe your therapist or coach, someone who is going to really support you in protecting that little seedling. Now, of course, once time passes and these insights have been fully downloaded and fully grown, it's going to become like a big, mighty oak tree. And then at that point, feel free to share with others, because now it can withstand the storms. It can withstand the wind. It can withstand the rain. Similarly, when you have a new belief that's fully grown and developed, it's going to be able to withstand different opinions and criticisms. Go here from Reset Ketamine, and I came across a really interesting scientific article that was published in September 2022. And this article is titled, A Novel, Brief, Fully Automated Intervention to Extend the Antidepressant Effect of a Single Ketamine Infusion, a Randomized Clinical Trial, published in the American Journal of Psychiatry in September 2022. And basically, in this study, they took patients with treatment-resistant depression and gave them a single infusion. After that infusion, they would have them play a game that consisted of positive associations like smiling faces and positive messages. And so those were delivered for 4 days after that single ketamine infusion. And what they found was that the patients who had received those positive messages and smiling faces via a computer game had much better results. If you think about this, it actually makes quite a bit of sense because, as you and I know already, ketamine increases neuroplasticity via increasing brain-derived neurotrophic factor. So one of the things that we always tell our patients is to be really cognizant of that time period right after the ketamine infusion. So for example, if there's someone that they call and always don't feel good after that telephone call, or if there's someone who just kind of brings down their mood a bit, give yourself a break from that person. Don't talk with them or call them for the next few days, because what we want to do is take advantage of that neuroplasticity by associating yourself with people who are more positive for you and who just make you feel better, or doing things or activities or other images that make you feel good. This is really important because neuroplasticity is almost like you're heating up a ball of clay. And so we can turn that ball of clay into what we want. Now, if it's being bombarded with kind of negative associations and negative images and kind of people who just aren't a good fit for you, that can also have the neuroplasticity lead to kind of a negative experience. So at the end of the day, the bottom line, here's what's important. After the ketamine infusion, really take advantage of that neuroplasticity and associate yourself with things that are going to lift up your mood. One of the concepts that's really important is this idea, and it's a quote actually: knowledge is nothing until it is applied. I'll repeat that again. Knowledge is nothing until it is applied. During the ketamine therapy, you might gain insights and knowledge and wisdom. Maybe you need to change something in your life. Maybe you need to add something. Maybe you need to stop something. And so one can gain insights and knowledge during the ketamine infusions. But if we don't take action on that after the session, and I think about this as kind of homework in between the sessions, that action and execution is really important because you might have the greatest insights, but if there's no resulting action or even new way of being, it's kind of not as beneficial unless it is applied. So I invite you, after the ketamine infusion therapy, to integrate the experience by taking an action afterwards, because you might have the knowledge, but if it's not applied, it's actually not very useful. I think about this other concept of someone who has a lot of books in their library, but doesn't do anything with it, is just the same as someone who's never read the book anyways. So take action. It's really important. Execution is critical during the ketamine infusion therapy because ketamine, I view it as a catalyst. It gives you that activation energy. And a lot of our patients, they've started doing meditation or journaling or talking with a therapist or a coach or taking a break from alcohol, marijuana, etc. Like making these healthy life decisions is a little bit easier because of that neuroplasticity that comes 24, 48, 72, 96 hours after the ketamine infusion. We know biologically that there's new neurons being formed, that there's new synaptic connections being made. So really taking advantage of that time after the session is so important. And it looks like taking an action. So what action are you going to take today? I hope this compilation has answered some of your questions about what to expect and do after your ketamine therapy. If you found this video helpful, please like, share, subscribe to stay up to date on the latest about ketamine therapy. And I will see you in the next video. Thank you so much for watching.